There's a growing body of evidence that austerity policies are having a negative impact across the country. We wanted to bring together frontline workers who, as well as delivering services, are also gathering evidence of that negative impact and then using that to try to influence policy making.
There are thousands and thousands of people presenting to the food banks in Liverpool now, and the numbers increase each month. And an increasing percentage of those people are families in work.
Over 1 million people now use food banks in the UK, and it's been found that 84% of people who use food banks report feeling humiliated by the experience, and 43% of people actually hide the fact that they've used food banks from their children, so even feeling that level of humiliation and shame within their own families.
One of the good initiatives that's happened in Liverpool has been something called Advice on Prescription, where GPs are able to get patients to see somebody within the health centre who can provide welfare rights advice. 2/3 of the people they're seeing have underlying problems that aren't to do with their health, but to do with their social situation, and very often a lack of money.
We kept hearing stories about how people were being turned away by private landlords because they were claiming housing benefit. So we did a snapshot survey where we called up landlords across the borough. We found that out of 1,500 properties being advertised, only 1% of those properties were available. A, because they were affordable within housing benefit limits, and B, because they had landlords willing to rent to housing benefit claimants.
There's a wealth of evidence and stories here, and these groups have had small victories at a local level with local policy. But what they really want to see is national policy change. And in order to achieve that, we need to spread their message and make sure it counts with the politicians at Westminster.